Good afternoon, everyone. Thanks for joining us to get the most updated information about our pandemic response here in the state of Illinois. Let me begin by reminding everyone of the unfortunate truth. COVID-19 has not gone away, and it remains a serious threat. You watch your online news feeds or TV without seeing reports of record cases and deaths across the United States, then you're missing something, because we see it in places like Florida and Texas, California, Arizona, and Alabama, and other places. And we're seeing positivity rates rising and at new heights in our neighboring states of Iowa and Indiana, Missouri, Kentucky, and Wisconsin. Illinois' careful reopening and conscientious people who are mask-wearing, social distancing residents of our state have kept our positivity rates at around half of our nearest neighbors, 1/6 of Florida's and 1/5 of Texas. But let's not forget that it doesn't take long at all to reverse all of our gains and for a trajectory of success to be turned on its head. COVID-19 knows no boundaries, and the United States is one indivisible nation. If there had been one national strategy employed by our federal government, like a national mask mandate, perhaps things would be different. But that hasn't happened, and we can't rely on that possibility. In the meantime, Illinois has set policies for itself, and we've seen real progress over these last 4.5 months, but our numbers now appear to be gradually rising, and that's very concerning. Today, we're reporting nearly 1,600 new confirmed cases of COVID-19, our highest in the month of July. I will remind everyone that we look at these numbers via 7-day rolling averages and not one-day totals. But a rise is still a rise, and it is on all of us to bring these numbers down. There are those who mistakenly think, no problem, you can't eradicate the virus, and our numbers are so low, we don't need to do anything about it. To them, I would say that in every one of the states like Arizona and Florida that are in full-blown crisis right now, it started with a gradual rise in the numbers. The best doctors in our state, who are some of the best in the nation and the world, tell me that a gradually rising positivity rate is exactly when the exponential factors can take over. You can go from 3% positivity to Arizona's 23% positivity in the blink of an eye. We've been there. Let's not let that happen again. And let me also say to virus deniers, this virus is not a blue state virus, and it's not a red state virus. The deadly nature of this virus is not a hoax. Choosing to go out in public without a mask is not a political statement. Going out without a face covering on endangers the other customers at the grocery store. It puts your friends and your family at risk. There's nothing political about that. It demonstrates a callous disregard for the people in your community and in your county and in our state and our nation. The enemy is not your mask. If you're not wearing a mask in public, you're endangering everyone around you. So the enemy is you. Yesterday in the Metro East region, I sounded the alarm on the region's 7.1% rolling 7-day average positivity rate compared to the state's overall 3.1%. Outside of Metro East, the rest of our 11 regions all fall below 5%, ranging from 2.2% in Region 6, Eastern Illinois, to 4.9% in Region 7, Kankakee and Will counties. As IDPH Director Dr. Ezike and I announced last week, the state will take immediate action to impose additional mitigations if a region crosses over the metrics that we set. And Metro East is coming dangerously close to that. So I have spoken with local leaders, and I've asked them to clamp down on the outbreaks where they are occurring so that the state won't have to step in. We're now testing record numbers of Illinoisans, and we've brought our overall positivity rates down to low single digits statewide from a high of 23% in early spring. If that number pushes back up past 8% in any region, that's a problem of local businesses and residents not following mitigation strategies. Contrary to what the president says, more testing does not cause rising positivity rates. With local information about outbreaks readily available to the public on the IDPH website and on local public health department websites, we're counting on city and county leaders doing what they know is right to protect their residents. And we're counting on local residents to hold their elected leaders accountable. Demand that they take action early so that regions don't have to undergo the challenges of staying at home or closing local businesses again. If it sounds like I'm taking this extremely seriously, it's because I am, and you should too. It's imperative that we hold on to the success that we've had against this virus. We've made tremendous progress since we launched this battle just a few months ago. To begin with, Illinois has built one of the largest testing programs in the nation. Since our last update just a week ago, Illinois has set a new record, surpassing 40,000 tests in 3 of the last 7 days. Volume at our drive-through sites is up 53% since July 6th, and we are expanding to more lanes at high-volume sites and bringing on larger lab capacity to ensure results are returned as fast as possible. We have over 280 testing sites around the state, including over 100 federally qualified health centers that will serve anyone, regardless of insurance status. Find the site nearest you at dph.illinois.gov/testing. Critical to maximizing the efficacy of testing is contact tracing. We now have over 1,600 contact tracers who interview, trace, and provide follow-up for close contacts of cases in their respective jurisdictions. 57 of our local health departments, about 60% of them, have been granted $50 million in contact tracing grants, and there's more to come. Hiring continues, and anyone interested should connect with their local public health department if they want to become a contact tracer. And today, I'm proud to announce that beginning Friday, community-based organizations can apply for funding to do contact tracing in collaboration with local health departments. The COVID-19 Pandemic Health Navigator Program is geared toward organizations able to serve as coordinators for their region, sub-awarding to other agencies across 3 main areas of work: education and outreach, contact tracing, and resource coordination for those who need to isolate. Because Chicago and its immediate suburbs are running their own community programs, these grants are focused on regional leaders outside of Cook County. Of course, most important to our ability to minimize outbreaks is the efforts of everyday people to do their part. If one of our statewide force of 1,600 contact tracers calls you, please answer. And there's more that you can do by reminding your neighbors, your friends, your family to wear a mask when they're in public. Stay away from large gatherings. Maintain physical distance. Wash your hands. Test regularly, and continue looking out for your fellow Illinoisans. I have every faith in our ability to get through this and come out stronger on the other side. Before I hand over the podium, I want to address a few additional issues related to our COVID-19 response. First, unemployment. Across the nation, state unemployment systems have been overwhelmed by the unprecedented need brought on by this pandemic, and Americans in every state have paid the price. Here in Illinois, we're taking every measure to expand our processing systems and expedite benefits. And while that work is ongoing, every day that a resident's earned and deserved benefits are delayed, is one day too many. Unfortunately, that's just the tip of the iceberg with our national unemployment framework. This morning, the Illinois Department of Employment Security announced that we've uncovered and are investigating a nationwide fraud scheme impacting each state's federal pandemic unemployment assistance program. The department is working alongside federal law enforcement to investigate, pursue, and prosecute those who are involved in these illegal schemes, which are occurring in nearly every state. I want to ask members of the media to help spread the word that an individual who has not filed an unemployment claim, but has received a debit card or an unemployment insurance letter in the mail has likely been a target of this fraud. Federal authorities have informed states that your personal identifying information may likely have been obtained in prior breaches of corporate or other databases like the massive Equifax breach. That means it's possible that your personal identifying information was used in this scheme. If you received a letter from IDES or a debit card but did not apply for unemployment, please contact IDES at 800-814-0513. If you received a debit card in the mail, do not activate it. It's also highly recommended that you check your credit report for possible suspicious activity. Again, this is a problem being experienced all across the country right now because the national program was poorly designed and susceptible to fraud. But I can promise Illinoisans that our state government and law enforcement authorities will do everything in our power to support anyone who's been affected by this system-wide failure. I also want to provide an update for our residents who are at risk of losing their housing because of this pandemic. Since March, we've protected millions of Illinoisans by banning residential evictions. Today, I'm extending that moratorium through August 22nd. I take this step today because I want to ensure that we have support in place for those who are most vulnerable. As many of you know, we worked with the General Assembly to put in place two programs to help those whose housing is insecure, one for renters and one for homeowners, each distributing $150 million. Starting the week of August 10th, applications will open for renters, and then the week of August 28th for homeowners. Through the fall, recipients will be awarded grants of $5,000 for renters and up to $15,000 for homeowners. And meanwhile, we continue to explore partnerships and ways that we can provide additional support. For many people, their ability to weather this crisis hinges on their ability to keep a roof over their families' heads. It's not enough to say that we want to build a more just and equitable state on the other side of this pandemic. We have to take tangible action to get there. Today marks another step forward, though, frankly, our work is not done. So thank you, and now I'd like to turn it over to Dr. Ngozi Ezike for today's medical update. Doctor?
Thank you, Governor, and good afternoon to everyone. I'll begin today with an update on COVID-19 related metrics for cases, death, and hospitalizations. So since yesterday, we are reporting 1,598 people who are newly diagnosed with COVID-19 for a total of 165,301 cases. Sadly, we must also report 23 additional deaths for a total of 7,347 Illinoisans who have lost their lives to COVID. As of last night, 1,456 people were in hospitals across Illinois with COVID, and of those, 337 patients were in the ICU, and 132 patients were on ventilators. Testing capacity across the state continues to grow. To date, over 2.3 million tests have been run, with 39,633 being resulted in just the last 24 hours. Thank you to the people of Illinois for knowing that testing and knowing your status for that day is important and showing up to these testing sites. We have made tremendous strides, but as we anticipated, as more places open up and people gather in larger and larger groups, we are seeing an increase in new COVID-19 cases. You probably have seen people crowding into bars, areas where people were not wearing masks or not maintaining 6 feet of distance between one another. Maybe you've seen establishments hosting large events or large summer street parties. You may ask, why do we keep talking about face coverings and distancing? Because these are simple measures that will, in fact, help protect us and all the people around us. So I don't understand when trying to protect our neighbors became a bad act. I venture to guess that nobody is disappointed about all the lives saved and all the cancers that were prevented from keeping restaurants and bars free of dangerous secondhand smoke. I think we are proud to protect our waiters and our waitresses and our hostesses and our bartenders. I see this as a similar measure. Or look at it another way. Think of when you're driving an automobile. No one hopes to be in an accident. We wear seatbelts to protect us in the event that there is a crash. Seatbelts are used universally to save people in vehicles from harm or death. And we have a chance to do the same thing with masking and distancing. So what's the controversy? Not wearing face coverings, not social distancing, is what will take us back to the era that we were just a few short months ago, where we were reporting hundreds of deaths every single day. Each community is different, and what works in Rockford may not work in Taylorville. What works in East St. Louis may not work in Chicago, but there are certain things that are universal, and that's simple masking, face coverings, distancing, and washing our hands. Those are basic and universal. After those 3 W's of watching your distance, washing your hands, and wearing a face covering, the rest is not so formulaic. And so we're going to work region by region, community by community, to figure out what additional steps are needed. But the more people dismiss the science that says social distancing and face coverings work, the more cases we'll see. The more cases we'll see, the more dangerous it will be for people as they're trying to go back to school. It's up to every individual, each business, every community to uphold these very simple strategies to do what's right. Please wear a face covering if you're going out to dinner. Businesses, please require customers to keep 6 feet of distance between each other. Please require the use of face covering. Communities should take aggressive action when they see an increase in cases. That might be reducing the number of people that are allowed. There may be certain businesses that have to be suspended. Communities know best what activities and what behaviors that they are seeing that are resulting in the additional COVID cases. And we're trusting on the communities to help us identify the best ways to stop the continued spread. This is not about restricting freedom. This is about decreasing the transmission of this virus, which ultimately saves lives. It's that plain, it's that simple. This is about your actions and what you can do to keep you and your community safe. As the governor said, please let us not reverse all the gains that we have made. We actually do know things that will slow the spread of this virus. Think of your face covering as your seatbelt and treat it as such. Let's please watch our distance, wear our face coverings, and wash our hands. Thank you so much.